At this time, you've heard about systemic racism, and you've heard about the historical context. You've heard about psychiatry and the things that we need to do in terms of listening and how we need to dismantle some things there. And a lot of people have been asking about resources. So the next group that's going to come up, they'll talk about wellness within reach. And this is from the Brooklyn Free Clinic, and I'll call Janelle, Daniela, and Asma to come up, and so that they can share some resources with you. Thank you.
Thank you so much for staying and listening to this last talk right before lunch. We'll try to keep it brief. I'm Janelle. I'm one of the co-chief of operations of the Brooklyn Free Clinic.
Hello, my name is Daniela Diaz. I'm also a fourth-year medical student, and I'm one of the co-directors for psychiatry at the Brooklyn Free Clinic.
And I'm Asma. I'm like Daniela, also a medical student.
Okay, so just to provide a little bit of context, the Brooklyn Free Clinic, or the BFC, was founded by a group of medical students to provide primary care to the uninsured population of Brooklyn. And we've been operating since 2008 and are Brooklyn's only student-led free primary care clinic. So in 2014 to 2015, we were renamed to the Ann Castor Brooklyn Free Clinic in memory of our first physician volunteer at the BFC. And our overall mission is to address health disparities in Brooklyn, as well as doing this through service and education at SUNY Downstate. Our vision is that every patient has the resources they need to be healthy, and every student becomes a socially conscious provider. And our devoted medical director right now is Dr. Kaiser Islam. The community that we serve is largely East Flatbush, but we really serve any patient who does not have insurance. And so in East Flatbush right now, or at least the latest data showed, that 17% of individuals are uninsured. And this is in comparison to 13% in New York City, as well as 12% in Brooklyn overall, showing that we have a higher rate. And so who are our patients? So at the end of 2024, we saw 472 patients, and the majority of our patients were female, identified as Black, as well as Hispanic and Latino, which is similar with the population or the demographics of our population here in East Flatbush, which you can see on the pie chart on the right. So common needs of our patients here are primary and preventative care, as well as chronic disease management, particularly hypertension, as well as diabetes, and mental health services, which we're going to go into a little bit more next. And there are several structural, financial, as well as social barriers that limit access to consistent care. Some of the examples are language barriers and limited availability of culturally concordant care, as well as, recent immigration or relocation, financial instability that makes healthcare not as much of a priority as other necessities like food and housing, as well as transportation and time constraints, and difficulty navigating the healthcare system and distrust of the healthcare system. And overall, all of these barriers contribute to delayed care as well as fragmented follow-up. And this, leads to reliance on safety net services like the Brooklyn Free Clinic and community-based clinics that are accessible to the community. So in terms of our operations, if anyone has patients that might benefit from these services, we are located at 470 Clarkson Avenue, Suite A, which is right on the other side of the SUNY Downstate building within the University Hospital of Brooklyn. And we operate every Wednesday from 5 to 10 p.m. Year-round. And we tend to have first contact and follow-up health maintenance visits, as well as work physicals and non-emergent acute care, so primary care services. And we also have the opportunity to do referrals to specialty services all around University of Hospital of Brooklyn, as well as Kings County, and cancer screening programs that is available through Betty Jung, our nurse that helps us with that. We also offer lab work on site, so phlebotomy, STD tests, as well as pap smears. And other additional on-site services we have are medical interpretation, needs assessments, HIV rapid testing, as well as patient education and psychiatric services. I also just wanted to say that, we are able to do this through the services or the volunteering of our students, which is multidisciplinary, that encompasses, our medical school, physical therapy, nursing team, as well as like occupational therapy and all the rest of our schools here, including public health and others. So, yes, we're gonna go into more of the psychiatry services.
So when patients come into the Brooklyn Free Clinic for their primary care services and share any concerns they have regarding psychiatry, whether it's symptoms of depression, anxiety, or other psychiatric symptoms, they're referred to us at BFC Psychiatry specifically. Ozma and I, as the co-directors of BFC Psychiatry, receive the patient's chief complaint, a brief kind of summary of the concerns that they expressed during their primary care visit in clinic. And we reach out to them via email first. Through this email, we let them know that we were told that they were interested in psychiatric services, and we schedule a phone call. So this initial phone call at an agreed upon time is our initial intake. And as you can see on the slide, we discuss a variety of things in terms of their past, psychiatric history. We go through their chief complaints, their goals of care, whether this is primarily for medication management, or some patients want to discuss their options for therapy, or both. We discuss both over the phone with them. We go through their past diagnoses, if they have had any, if they've ever been on any psychiatric medications, any prior experiences with therapy that they've had before, what worked and what didn't work for them, just so we have a full picture and we can kind of point them in the right direction. Another thing that's important for us to talk about with our patients during this initial intake phone call is their social support. So we kind of discuss a little bit about their family and their peer relationships to kind of see who's helping them, if anyone at all, during their lowest periods in terms of mood. And lastly, we do a little bit of screening. We screen for substance use, suicidality, and depression and anxiety. For screening for depression and anxiety, we use the PHQ-9 and the GAD-7 to kind of gauge the severity of their symptoms so that we know how to move forward with them. So if a patient is interested in medication management, in certain cases we can help them with that directly at the Brooklyn Free Clinic. The first step in this process is to set them up with an in-person primary care appointment, especially if they haven't been to the Brooklyn Free Clinic in person before. And this is just to establish, a relationship with the patient and to get them in with a full comprehensive assessment. So at this visit, we address both their psychiatric and their medical needs, if any. At this visit as well, our clinic's primary care provider for the night may initiate a short-term SSRI, which is an antidepressant, in cases where it's appropriate. So patients can pick up their SSRI at Life Care Pharmacy, which is our partner, free of cost. If they're able to cover the cost for the medication, then we are able to send the medication to a pharmacy of their choice as well. Then our next steps in terms of psychiatry is we want to really make sure we're closely following up with these patients that we're prescribing medications to. So Ozma and I will send them emails maybe a week or two after their inpatient appointment just to make sure that they aren't experiencing any side effects. And then after that, we schedule them with in-person appointments every 3 months just to follow up with them see if they need any refills, any changes to the medication, and just to also, it's really important for us to keep that relationship with them ongoing for as long as they need.
So I know we talked about medication, but also a big part of this was also patient-centered care. So if patients wants therapy, we wanted to make sure there's initiatives for that. So actually last year we started this psychotherapy elective. It was like funded by an APA grant, which we were very happy about. It kind of expanded a lot of the medical student education. Like we tend to focus on medication, and I think one thing we learned from the morning was just being able to ground our care, not, in the context of our patients. And so this kind of was a very good way to kind of incorporate therapy into the clinic. Really quickly, I know we're kind of running over time, but these are fourth-year medical students who are supervised by a psychiatrist and a resident, and it's working well, and we have, it's ongoing. And so it's also telehealth, so that's another kind of aspect to expand the care, because that can be a great way for patients to connect if they're not comfortable, or just offer that, especially if they're working or they're busy, and really understanding the patient's situation. Once again, just for the sake of time, I'll go through this quickly. Yeah.
So for patients who aren't interested in participating in our medical student elective or the solution-focused therapy that we offer, or if space is limited at this time and our students aren't able to take on a new patient, we of course invite our patients to remain on the wait list for our elective, and we'll let them know as soon as possible when a spot is available for that. But if not, we tend to refer them to these two external clinics for therapy. So the first being the SUNY Evening Training Services Clinic. BFC can provide a direct referral to this clinic, as it is through Downstate. At this clinic, our senior psychiatry residents provide free psychodynamic psychotherapy sessions for patients on a weekly basis. It's virtual, and they really work with the patient's schedule. So the way this works is that they provide us with a standardized intake questionnaire. We send that to the patient sends it back to us, and we kind of directly connect them to the SETS clinic. If this isn't an option that is appropriate for the patient, then what we tend to do is give them the information for Kings County's various adult outpatient psychiatry clinics. And that's because Kings County accepts walk-in appointments. So for that, we just give them the schedule of when Kings County's clinics are open, and they can go in there for a brief initial visit and get started with the providers at Kings County. But we also don't limit our resources there. We also provide all of our patients with these two links so that they can explore other community resources on their own time. So the first is the Low Cost Therapy in NYC website. This is a website that we found that kind of lists a bunch of different clinics all over the 5 boroughs, and all of these services are either operate on a sliding scale or they're free of charge, which is really helpful for our patients, especially those who don't live close to the Brooklyn Free Clinic and prefer a more convenient location in terms of clinics. And this is also really helpful for patients who aren't interested in the specific types of therapy services that we can provide. And the second website is the National Alliance on Mental Illness website. This website is also really helpful for patients to find support groups and get connected with peers to really discuss and find that support with those who are going through similar things to them.
Again, really quickly, just to tie the conversation together, and also the phenomenal speakers in the morning. We're kind of honored to be here. We're kind of a side thing. So, just like the community does face a lot of barriers, and, whether it be lack of insurance, discussing social determinants of health, there's long wait times, unfortunately, when seeing these providers, of course, the structural barriers, the oppression, and all of that. But one of from our end, one of the proposed solutions is having more mental health integration into primary care settings. So primary care settings, these are patients coming in for regular visits, but if we screen for mental health, we kind of reduce that stigma, normalize talking about mental health concerns. And then, of course, future directions, continuing to provide that culturally sensitive care, events like these that kind of promote awareness of issues, and then continue to build community partnerships. This is our website and our Instagram. Please follow, and then also our email if you want to stay connected. Thank you.
So thank you so much. Let's give them another round of applause.